My name is Dr. Robin Shermis. I'm the Medical Director of ProMedica Breast Care on the campus of the Toledo Hospital. We are a large breast imaging center where our main goal is to detect breast cancer. We use molecular breast imaging, or MBI, primarily as an additional surveillance tool in our large breast care center. Women who have a dense or complex mammogram will undergo MBI. The molecular breast imaging we use is put out by Gamma Medica, called the LumaGEM machine. We adopted the LumaGEM MBI system about 2.5 years ago when we were trying to decide what would be the best adjunct screening tool beyond the mammogram. Screening breast ultrasound offered too many barriers in terms of trying to evaluate the meaningfulness of findings on the ultrasound. But MBI gives us a hot spot. Using just a small amount of radiation, we're able to get a physiologic tag to potential abnormalities and then target ultrasound to those areas. Since our decision to go with LumaGEM MBI, we've had over 2,000 cases of experience and find that it's very easy to interpret these examinations, and that allows us to go over the results with the patient following the study where we can attack potential problems at that point. In our facility, we want to go way beyond the mammogram because the mammogram only sometimes tells part of the story. If a woman has a dense or complex mammogram and is not high risk, she's going to get an MBI, and the MBI will allow us to pick up cancers that would ordinarily be missed by conventional mammography. It also provides, in the setting of a negative MBI, some level of comfort that goes way beyond the mammogram in terms of assuring a woman she does not have a breast cancer. It's important for women to know that if they have a dense mammogram, which we evaluate every time we look at a mammogram, both objectively by a computer program and subjectively by the radiologist, that in the right setting, in the setting of a complex or dense mammogram, she needs more than just a traditional mammogram. She needs to go on to either MBI or MRI. I've been in the breast imaging field for over 25 years, and when we first started, we only had the mammogram, which is great because we were able to reduce the mortality from breast cancer using the mammogram by up to 30%. Over time, we developed breast MRI, and that filled a real needed gap for women who are dense and at high risk for developing breast cancer. Over time, we also noticed that there was a large gap between the women who were not high risk but had a dense, complex mammogram for which the mammogram itself was not enough. MBI has filled that gap for women with a dense mammogram who are not at high risk. It's a cost-effective tool where we can quickly screen a woman, find out if there's anything important going on, and give the results to the woman right away. We need a tool that's cost-effective, efficient, and easy to use, and MBI fills that niche.